My name is Annette Bukulu. I'm going to be your nurse practitioner today. Mr. Joy, do you mind recording this video while I'm doing a physical assessment?
No, I don't mind.
Okay, so we're going to focus today on the head, the nose, the ears, and the neck, and the fur, and the mouth, okay?
Okay.
So I'm gonna clean my hands before I touch you. Alright, I'll inspect the head by looking at your skin to see the color of your scalp, the texture, the patterns of the hair. Is it evenly distributed? Or do you have any hair loss? And also to check for dandruffs to see if there's any dandruff, and also look for the bumps or depression on your scalp. Okay, that looks good. And I'll look at your face. I'll inspect your skin color for your face. Look at if there's any pigmentation. Look for the rash or any lesions, and I'll look at your facial expression to see if there's any changes while you're quiet, and also when you're talking to see if there's any deformities. Also look at the involuntary, if there's any involuntary movements, if there's any edema or masses. Okay, I'll palpate your face to see if there's any tenderness. Tell me if you feel any pain anywhere while I'm touching you. All right, I'll listen to your temporal arteries. Open your mouth for me. All right, that looks good. Okay, I'm gonna look at your eyes now. Okay, and check for the sclera and conjunctiva. Okay, look up, down, on the side. Okay, looks white. The sclera looks white, and your conjunctiva looks pink and moist. Okay, so now get up for me. Get up for me. Okay, get up. All right, you're gonna stand like 20 meters away from this chart. Can you read this chart for me? The smallest numbers?
L, F, T, P, H.
All right. Can you get this paper, cover one eye, the right eye? Read the smallest numbers here.
L, T, P, F, H.
All right. Look at the other side. Read again.
L, T, F, P, H.
Okay. You can have a seat. So your visual acuity is it's a 20/20, which 20 the bottom the up number shows how far you're standing from the chart, and the bottom number looks at how far you can read that chart. Okay. Now look straight to me. All right. I just want to see how your pupils react to the light. Visual paper. All right. All right. So now I'm gonna look at your near sight. All right, and see how the pupils constrict. Look straight. Okay. And now don't mind about the light, but I just want you to follow this stethoscope. Look straight, but just move your eyes. All right. Down. Okay. Okay. Down. Okay. All right. I've checked for the ocular muscle. Circular. All right. All right. So now I just want to see your red reflex. So I'll turn the number to 0. Okay. Okay. Turn the number to 0. All right. By looking at your red reflex of a pupil red reflex, I'll just try to check if there's any redness, any bulging in your eye, and checking for that. I'll make sure for convenience I'll just look at your right eye using my right hand. Okay. I'll just go. All right, and I'll just move, adjust this to check for the vessels, the blood vessels. All right, I'll do the same for this eye. Okay. All right. Okay, I'm looking at the blood vessels. If there's any redness or now, I'm gonna look at your check your eyes. Okay, I'm gonna first look at your nose. Okay, I'll check for the I'll look for the ears. I'll check your ears. Okay, so by inspecting your ears, I'll look at the skin color. Okay, to check for skin color. Sorry, check for the skin color. If there's any swellings. Okay. And then I'll check for the tenderness. Woo. All right. I'll check for the tenderness. And do you feel any pain while touching it, pulling it?
No.
Okay. So that shows that there was no more like inflammation. But if it's in pain, sometimes you're gonna have like an infection. What happened? Okay, so now I'm gonna check your internal ear. Okay, I'll pull up, okay, and out for that out, and I'll go in to look at your eardrum and to look for the curamine, and also check for any foreign objects and any discharge. And it looks pale gray, pale, so it's okay. There's no redness. If there's any bulging, any redness, most of the time it's gonna be like an infection. All right, now I'm gonna check for your hearing. Okay, I'm gonna whisper one word and you let me know. Okay, I'll repeat that word for me. Okay. Okay. You wanna hold it for me? Thank you. All right.
Apple.
Okay. I'll do the same for the other ear.
Apple.
Okay. All right. So I'll gonna do the Weber test. This will help tell me when you hear a vibration. Okay. Top of your head. Where do you hear it? What ear does you hear the vibration?
Both ears.
Both ears. Okay. All right. And I can also feel it. You can tell me if you feel the vibration. You hear the vibration? Okay. What about here? Do you feel it? Okay. All right. So most of the time, when you put it on the, you're gonna feel it more when it's in the air. Like, but when it's on the bone, you won't feel it that much. Okay. So I'll look at your nose. Okay. I'll check for your uh, for to see if there's any discharge, if there's any swelling. Okay, hold your nose for me. One side. I'll check for the patches. Okay, I'm doing the other side. Okay, all right. I'll check for the sinuses, nasal sinuses, looking at the temporal temporal sinus. Okay. Do you have any pain?
No.
What about the temporal, the maxillary too? Okay. All right. And then now I'm gonna look at your nose. Okay. So I'll check for any discharge, any redness, and it looks nice, and there was no discharge or so. Just remember, when you're looking at eyes, you have to check for the irid clustering, and also you have to look for the tearing if a patient has any the tearings, their eyes. Okay. And I'm gonna do the mouth. Okay. Using the mouth, I will just put on my gloves because I'm gonna check inside the mouth.
Okay.
All right. I'll look at your lips. Okay. All right. And I'll use a tongue depressor. Right now, I don't have a tongue depressor, but I'll just open your mouth for me. I'll check for the tongue, stick out your tongue. Okay. I'll just look at the mucosa, the membrane, to see if there's any swellings, any redness, any sores. Okay. Stick out your tongue for me. Okay. I'll use a tongue depressor and say ah. Okay. I'm just looking at the soft palate, how if and the vulva, if it's in the middle, in the midline. Okay. All right. I don't see any deformities. And also I'll check for. Do you have any pain in the mouth?
No.
Okay. All right. So now I'm gonna look at your neck. Okay. So with the neck, I'll inspect to see if there's any the size of your neck, the shape of your neck, if there's any problem with the mobility, and also if there's any tenderness. Okay. Hold it. Okay. All right. So now I'm gonna check for the periauricular. Okay. Okay. I'll look for posterior auricular. Okay. I'll check for the orbital, occipital. Okay. Palpitate. And then I'll check for some mandibular, and also some mater, and also I'll check for superficial superficial cervical, and also posterior cervical. And then I'll look at your trachea to see if it's symmetric and midline. Okay. All right. Swallow for me. This helps me to see how your trachea, how it moves, and also how your thyroid gland, your thyroid, if there's any swelling. All right. So I'll palpate in the back to feel your thyroid gland. Okay. I'll check. All right. And can you swallow for me? All right. It helps me to see the shape of the thyroid, and if there's any swelling, if there's any problem, the osmosis, which looks fine. Okay. All right. And I think there's no any deformities, no major deformities. Everything looks fine. All right. Thank you for being patient with me, and everything looks good.
All right, thank you.